Hello, and welcome to this NIDIS presentation on reducing mastitis through proper teat care. I'm Tom Warboys, a vet from Synergy Farm Health in Somerset. Mastitis means simply inflammation of the udder, which in almost all cases is caused by a bacterial infection. The number of white blood cells, which in udders are known as somatic cells, increases. Somatic cells can cause visible clots in the milk and can be measured to give an idea of subclinical problems. Mastitis is important for many reasons, the three key ones being animal welfare, food quality and cost, both to the individual farm and to the industry. Their implications come from the painful condition, altered behaviour and, importantly, public perception. Milk quality is affected by the presence of bacteria and a high somatic cell count, changes to milk constituents, and even to shelf life. Finally, the cost of mastitis comes in many forms, including treatment costs and dumping the milk, reduced yields, repeat infections and spread of infection to herd mates, increased culling, and sometimes financial penalties. There are two main ways to categorize mastitis. The first is to consider the source of infection. This will be either the environment or other infected cows via the parlour. These cause environmental and contagious mastitis respectively. The other way to categorize mastitis is to consider the symptoms. Clinical mastitis causes visible changes and can be categorized into mild, moderate, or severe. This depends on whether changes are to the milk alone, which is mild, milk and the udder, which is moderate, or milk, the udder, and systemic signs of illness in the cow, which is severe. Subclinical infections cause no visible change and can only be identified by tests in the parlour or a lab. These cases of mastitis can cause significant problems despite the lack of symptoms. Understanding teat anatomy can help us manage udders to reduce the likelihood of an infection. The teat consists of the sinus within the teat, the sphincter, and the streak canal at the very end. The sphincter is a ring of muscle at the tip which opens on stimulation to allow milk flow. It closes after milking to seal off the udder. The sphincter is the main point of entry for bacteria, and much of the parlour routine should involve protecting it. Teat preparation is covered in the next two slides and is essential in preventing infection through this point. Parlour settings need to be monitored carefully. An incorrect setup, which leads to excessive vacuum levels or over-milking, can damage the sphincter and increase the risk of infection entering the udder. The photo shows an example of teat end damage, with a thickened sphincter and protrusion of scar tissue from inside the teat, known as hyperkeratosis. There is also short-term damage, causing hemorrhages in the skin. The scar tissue prevents the sphincter from closing effectively after milking, increasing the risk of entry of bacteria. In addition, the scar tissue is almost impossible to disinfect properly and can harbour bacteria. The pre-milking routine should start with quiet and efficient handling of the animals. This will reduce standing time, stress and injuries, and importantly allow the natural release of hormones required for the cow to let her milk down. Stress, in particular adrenaline, interferes with milk letdown. Physical stimulation of the teat by stripping and wiping is needed to achieve full oxytocin release and effective milk letdown. If there is insufficient stimulation or clusters are attached too soon, bimodal milk flow occurs. This is seen as an initial milk release from the milk already in the lower udder, followed by a reduction in milk flow, until the physical stimulation of pulsation triggers oxytocin release and milk flows again. From the initial stimulation of stripping and wiping, the optimum time to cluster attachment is 60 to 90 seconds. This allows a full and constant milk flow from the udder. Even with the extra stimulation before cluster attach, overall time in the parlour is normally the same, if not quicker, since the better milk letdown reduces milking time for each cow. The importance to mastitis control here is maintenance of teat health, with teats exposed to fewer periods of low milk flow where the vacuum on the teat end is highest. Teats and udders only need washing if severely contaminated. Once the teat has been stripped and milk examined for mastitis, each teat should be cleaned. This will involve pre-dipping and wiping or simply dry wiping for the majority of farms. Leave the 60 to 90 second pause before attaching clusters. In this time, a milker can prep around 5 to 7 cows, so prepare cows in groups of this size, then go back to attach clusters before moving on down the line. Each farm will have its own routine, and it is important to discuss this with your vet to find the protocol and products that achieve the best result for you. There are two important properties for all pre-milking dip products. They must be quick-acting to kill off bacteria before milking, and must contain a detergent to aid in cleaning the teat surface. Doing things in the order shown will kill any bacteria that have been released from the udder by foremilking. Ensure a clean, single-use paper towel or washable flannel is used for each cow, and if using washable products, ensure they are properly cleaned between milkings. Always wear gloves in the parlour, as they will be cleaner than hands and can be washed or preferably changed easily. After milking, apply the post-milking dip or spray immediately. Post-milking dips or sprays must contain a long-acting antibacterial product to protect the teat end until the next milking, and they must contain a moisturiser to keep teats in good condition. The different requirements for pre- and post-milking dips mean it is very rare to find products that can be used as both. The most important point about dipping or spraying is that every cow has all 4 teats covered completely in the product after every milking. The sphincter in the teat end takes 30 minutes to close properly, so keep cows standing in a clean area for this time to allow closure before lying down. Providing fresh feed and water and appropriate feed space will ensure most cows do this voluntarily. Mastitis control is vital for welfare, cost, and food safety. The parlour is both the time of greatest stress on the udder and the best opportunity to examine it. Parlour routine is therefore a vital control point for mastitis. Allowing time between stimulation of the udder and attaching clusters means teats are protected from over-milking and retain their proper seal against the environment. Using appropriate teat dips or sprays for both the pre- and post-disinfection is critical. Work with your vet to identify and control potential risk factors in your herd. Thank you for taking the time to listen to this NADIS presentation.